Today I will be explaining syringe setup and then setting up a syringe for you. The syringe is used to administer local anesthetic, which is used to control pain. Topical anesthetic is used on the outer layer of the tissue to numb the injection site, so this will make the injection or shot less painful. The two most common injections are infiltration and block. Infiltration is used on the top teeth, and the injection will be given in the tissue just above the tooth or teeth being worked on, and only those will become numb. A block injection is given on the lower back side of the mouth and will numb one entire half of the lower jaw. This injection will also make half of the tongue and lower lip numb. Even though the tongue and lip feel swollen, they will not look swollen. There are different types of anesthetics. The type of anesthetic used will be dependent on the procedure and the patient's health history. We need to be careful to use the correct anesthetic, or else the patient could have an allergic reaction, or the wrong anesthetic could cause serious problems for the patient with heart conditions or other medical concerns. There is a different size needle. A 1-inch needle is used for the infiltration or the top injection, and the 1.5-inch needle is used for a block injection or the bottom injection. I will now demonstrate how to properly load a syringe. So right here I have all of our anesthetic that we have to choose from, and then all the needles that we get to choose from. We have 2 syringes, 2 recapping devices, and then we have some cotton pads with alcohol on them. And so with the anesthetic, some have epinephrine in them and some do not. Epinephrine just helps the appointment last longer and reduces bleeding, and yeah. And then we have some with no epinephrine in them, which are for patients with health conditions or heart problems, pregnancy, all of that. This one has 1 to 50,000, so this one has the most epinephrine in it. So we are gonna grab a cotton pad with some alcohol on them, and we're gonna just take this top part and disinfect this pretty good, because that's where the needle's gonna go in at. After that, we're going to take our syringe. You're gonna wanna make sure that cap that you just disinfected is at the top of the syringe. You're gonna just slide it in. You're gonna wanna pull back on this so it can drop down in there. And then you're just kinda gonna push it or hit it to make sure that it's all the way in. You wanna turn it, and if the anesthetic turns with it, you know it is in there pretty good. Next, we are going to pick a needle. So we'll do a long needle, which is for a mandibular or a lower appointment. We're gonna take the bottom off. We're gonna put that in a recapping device. The recapping device just kind of helps not poke yourself, an easier way to recap the needle without injuring anybody or yourself. Now, there's a tiny needle that I'm going to put in that little hole right there. And then you're gonna be super careful to make sure and not bend that needle. You're gonna wanna turn it. And then this is the point where you would hand it to the doctor. They would take it, and then you would use your left hand to take that cap off. In order to get it back, you would take it back like that. Again, the recapping device, recap it. How to take this apart: you would unscrew this. Again, put that in the recapping device to make sure that nobody gets poked. And then to take this cartridge out, you're gonna wanna just pull back on this syringe and